Hi, I'm Maddie. I'm a student PTA. This is my 18th take of an analysis on a randomized controlled trial called 6 Months of Program Sports Therapy in People That Have Hemophilia, an Improvement of Their Physical Fitness. This is an RCT about the effect of sports therapy on symptoms associated with hemophilia, as well as an effort for the researcher to prove that you can increase their physical fitness capacity during program sports therapy. Hemophilia is a bleeding disorder in which sufferers have a dysfunction of their blood clotting proteins, specifically factors 8 and 9. So that is when genes are being coded to make the blood clotting proteins, theirs are either mutated, misformed, or just completely missed. So they do not create the blood clotting proteins that we need to coagulate our blood or stop our blood when we begin bleeding. These individuals experience episodes in which they bleed profusely, which can cause lots of problems. Some of these problems include bleeding into their joints that cause swelling, tightness, specifically elbows, knees, ankles, bleeding into skin, muscle, soft tissue, which is known as a hematoma, blood and urine, frequent and excessive nose bleeding. But there is treatment. Treatment for these sufferers include infusions in which blood clotting proteins manufactured are injected into the veins of the patients. After a while, they learn how to do this themselves so that the blood clotting proteins can build up and they have less frequent episodes. So the goal of this randomized control trial is to decrease these symptoms that they have to suffer from, as well as improve physical fitness capacity in sufferers of hemophilia. Sports physical therapy, which is going to be our intervention for the experiment, is a method of therapy that utilizes sports and exercise science administered through a training program, which would be a plan of care for physical therapy, to encourage healthy physiological and pathological processes. So, due to this chronic disease, sports and exercise are usually discouraged in people that have hemophilia just because of the risk of trauma or excessive bleeding episodes. We don't want that. But patients exhibit poor basic motor skills. Bleeding episodes can often lead to atrophy. Atrophy is the breakdown or decrease in size of muscle, and this is due to the fact that the swelling and bleeding around their joints cause poor joint mobility after episodes, as long as poor stability in the muscles surrounding the joint, because they begin to atrophy with less movement. If you don't use it, you lose it. So Erbsled, one of the researchers, began this intervention with the intent to improve sensomotoric skills and static muscle strength and ability to condition with minor joint sprains after 6 months of proprioceptive, coordinative work along with moderate strength training on patients with hemophilia. He specifically states that he wishes to do so during his experimentation without sacrificing the quality of the experimentation. So how do we do that? Who, what, when? So his experiment begins with 64 patients with moderate to severe hemophilia. 5 of these patients have moderate hemophilia. 59 of these patients have severe hemophilia, which is determined by a series of medical testing, blood testing prior to the start of the experiment. So these patients are separated into 2 groups, 32 each, 32 whom will experience the intervention, which is a sports therapy program, and 32 who are a control group. They'll just go along doing their normal daily tasks, activities. So these patients are between the ages of 1966, never trained in a facility before due to the precautions, the warnings about exercise for people with hemophilia. So after being medically examined, these 32 people in the intervention group will be trained for 6 months in total for 2 sessions a week, 90 minutes. Prior to starting this program, there's going to be pre-measurements, these same measurements will be recorded after the program to determine if there's any change, increase, decrease in the strength, the walking capacity, balance, mobility, coordination series of measurements. The first measurement is a complex strength test, which is a test of isometric strength performance. So mobile strength sensor is attached to a cable machine, a pulley machine, in which exercises that work the muscles, the triceps brachii, the biceps brachii, your quads, your hamstrings, which are your biceps femoris, your abdominis rectus are used. So several of the muscles. Then there's walking capacity test, in which these patients are put on a treadmill for 12 minutes. And after that 12 minutes at a pace that they can walk as fast as they can, we see how long they have gone, the distance. Then we test their balance prior to the experiment. One leg stand on flat ground for 30 seconds. The experimenter watches them, see how wobbly they are, unstable, and rates that. The last test is the joint status test per the Gilbert Joint Scale, and it's used to classify arthropathy, so like a disease or a dysfunction of the joint. So let's talk about these interventions and how we're going to test all these measurements that we just recorded. So we're gonna do this for 6 months, testing mobility, coordination, strength, endurance in these patients with hemophilia. So the strength training program, the regiment consists of 6 months of this, 2 times a week, 90 minutes, in which every 4 weeks, the progress, like how they're doing, are going to be checked, determined, the success of every 4 weeks. So 30 practices will be used, 5 to 9 exercises for strength training, like a leg press, a curl, a face pull, and 3 sets, 15 reps each. After 4 weeks, these patients will be assessed by the physiotherapists, and then we'll move that up. For mobility and endurance, these individuals have a specifically tailored program in which 10 to 30% of their mobile and endurance capacity is measured. And then after these 4 weeks, if they're good, then they'll move up to 40 to 50% of that capacity and continue to increase incrementally. So before we move into discussing results, we're going to discuss the limitations, the successes of this experiment. Reliability and validity of the experiment are very high. No bias because patients were randomly chosen, extensive medical testing prior to determine the comparability between patients. So like, is this patient too old to be compared to a young person? Disability, illness, external factors. Credibility, it's up there because licensed sports physical therapists, as well as physiologists and doctors of hemophilic centers are including experiments. They're taking the measurements, and these measurements are taking place at a qualified fitness center. So these fitness centers, as these patients are coming in twice a week for 90 minutes, their attendance is being taken. If the patients don't attend their training session after 13, they're done, they drop. So variability that may cause discrepancies, it's taken into consideration. Validity, established by consistent analysis of the progress, execution of the program. Every 4 weeks, a therapist is assessing them themselves. Attendance, and then quality. The quality of the experiment is really good, is positive because of the design. It's a replicable design. It's the measurements, the training regimen, it's able to be repeated. It's scientifically backed, and the program is tailored to their specifics, their disabilities, so that it's all pretty much an even ground. So the results: 52 out of 64 of these people with hemophilia, due to inadequate compliance of 4 of the participants, and 8 dropouts due to their assessments that were inconclusive, were in the results. For strength training, we have a highly significant changes between the pre and post program measurements in muscle strength. Larger effect size, clinically significant results. 12-minute walk test, the results highly significant. Not only were these patients walking a farther distance at the end of the training program, but at a faster pace. For balance, significantly different. Joint score, increased joint stability in right knee, specifically, of most of these patients, while the joint stability of the other elbow knee joints, not statistically significant. And bleeding episodes. There was no decrease in hemophilic bleeding episodes, but there was no increase, -1, that was a possible due to training. So these results, they agree with the data, and they identify that the results reflect a highly controlled experiment in comparison to other studies in which the researchers include at the end. Objective and subjective analysis of the data and the statistics cover all grounds of assessment. Conclusion of the experiment includes mention of similar studies like I stated and what should be investigated further on the next experiment. Finally, researchers state that the results are clinically applicable or clinically significant due to the fact that fitness was improved. Not only just for a general population, fitness was improved in the human being, but in hemophilia sufferers, and bleeding episodes did not increase. So that precaution in the beginning where risk of trauma, don't exercise, it's not accurate. Clinically, this could be an experiment or a type of therapy used to treat people with hemophilia versus an infusion. I'm sorry that this was so long. I really am.